been 2 years since the global pandemic was declared by the World Health Organization. Since then, the world was flipped upside down. But now, 2 years later, thanks to vaccination and research, at least here in Canada, we're beginning to move forward. But that can't be said for other parts of the world. It's a moment in history that would change life as we know it.
COVID-19 can be characterized as a pandemic.
Masking, social distancing, and staying home all became a part of daily life as we learned to navigate through the pandemic. And within those 2 years, holes in the system were also exposed.
We saw that people who experience structural vulnerabilities like poverty, homelessness, even racism, are often people who are going to be hit hardest. And we saw this through every stage of the pandemic.
Those structural inequities were not exclusive to Ontario, but really felt in the global south. While the number of COVID hospitalizations and ICU admissions are slowing down in Canada, experts say in other countries, it's a completely different scenario.
North America is going down, South America is going down, but Asia and Europe are climbing, right? So there are parts of the world now with massive waves.
Dr. Madhukar Pai is the research chair of epidemiology and global health at McGill University. He says the burden of COVID-19 is shifting to poorer countries, many of which still do not have access to vaccines.
While the vaccine coverage in low-income countries continues to be very poor, not even 15% of the population in low-income countries have received even a single dose, while that number exceeds 80% in high-income countries.
The World Health Organization has said the new global target for vaccinations is 70% of the total population by mid-2022. Dr. Pai believes that target will not be met due to what he says is the selfishness of the global north, including Canada.
Many countries, including Canada, have refused to support the TRIPS IP waiver, which would have allowed hundreds of companies in the global south to make their own vaccines. So that means a vaccine monopoly by the rich north is what's causing this vaccine apartheid.
According to the WHO, over 452 million cases of COVID-19 have been confirmed to date, and over 6 million COVID-related deaths have been recorded worldwide. And while it may feel like COVID is in the rearview mirror, Dr. Pai fears COVID could follow the patterns of other diseases such as HIV and malaria. And unless countries like Canada get involved, Canadians could also be impacted.
This is not done by a long shot. To declare a pandemic prematurely over and by pretending that it's gone just because we think it's gone is absolute stupidity. We should have used the lull to prepare for the next storm. That's what we should have done. And one way of preparing for the next storm is to vaccinate the world very quickly.
Our communities will not be safe until every single community in the world is safe. And paying attention to the ways that we experience inequities throughout COVID-19 and addressing those inequities now through global vaccine equity is so, so important.
Well, as we move into this third year of the pandemic, experts say that more variants are likely. Now, to date, about 3 billion people around the world still need a first dose of a vaccine. For a comparison, in high-income countries, 80% of people have received their first shot. Now, while Canada is trying to move forward from this pandemic, depending on tourism for economic growth, that is now being dampened by inflation. Our David Zura has that story.